The fatal conceit of Obamacare is that we're just going to make everybody buy our health insurance at the federal government level. Young and healthy people are going to go into the market and pay for the older, sicker people. So the young, healthy person's going to be made to buy health care, and they're going to pay for the person, who gets breast cancer in her 40s or who gets heart disease in his 50s. So take a look at this chart. The red slice here are what I would call people with pre-existing conditions, people who have real health care problems. The blue is the rest of the people in the individual market. That's the market where people don't get health insurance at their jobs, or they buy it themselves. The whole idea of Obamacare is the people on the blue side pay for the people on the red side. The people who are healthy pay for the people who are sick. It's not working, and that's why it's in a death spiral. Here's how we propose to tackle this problem. We want to have a system where we encourage states with federal funding to set up risk pools and reinsurance mechanisms. So, for example, in Wisconsin, we had a great risk pool that actually worked so that people with real high health care costs and diseases and pre-existing conditions could still get affordable health care. Well, Obamacare repealed that. They had a great risk pool reinsurance system in Utah, a good one in Washington State. All those are gone under Obamacare. Here's how they work, and here's how our system would work. We would directly support the people with pre-existing conditions. Let me give you a sense of this. 1% of the people in these markets drive 23% of the costs. 1% of the people in the individual health insurance market drive 23% of the costs. So a reassurance program is to cover more than just the 1%, to cover the people who have high health care costs. So by having state innovation funds to go to the states to set up these reinsurance programs, we would directly subsidize the people who have pre-existing conditions. Direct support for the people with pre-existing conditions so that everybody else has cheaper health insurance. What you do when you do this is the individual market, the people who don't have pre-existing conditions, they have much more stable prices.